so that we are keeping safe whilst the event goes on. Thank you.
Good morning, everyone. My name is Colin Sarinze. I'm a representative of Marriott Hotel from the loss department, from loss prevention department. I'll be giving you guys a brief safety brief that will keep you safe while you're in the facility. You're welcome to Lagos Marriott Hotel Ikeja, address number 122 Joe Laguna Eke Street. We wish to reassure you that Lagos Marriott Hotel Ikeja is safe with safety and security measures put in place. During the course of this event, to hear the sound of emergency alarm sound, please use the nearest emergency exit door. Like this door here is emergency exit door. Once you step out, you are heading towards the main entrance, towards the main gate. That's where we'll have our muster point. And during this period, the elevators all goes out of service. They'll come to this floor and their door
Good morning, distinguished guests, visionary minds, our esteemed partners, gentlemen of the press, ladies and gentlemen. It's my absolute honor to very warmly welcome you to this monumental occasion, which I dare say is an event where innovation comes together with collaboration to revolutionize healthcare in Nigeria and I dare say Africa by extension. Now let's imagine two great rivers, each with its unique strength, flowing from two opposite directions, merging together into one unstoppable force. That is what we're gathered here to celebrate today, that union between Sygen Pharmaceuticals Limited here in Nigeria and ORx Pharmaceuticals Corporations from Ontario, Canada, coming together to one unstoppable force known as the Sygen-ORx Biosciences. Ladies and gentlemen, statistics lets us know that we are in a world where 2 billion people lack access to essential medicines, and partnerships like this are very pivotal and critical. Sygen has its deep roots here in Nigeria, and they're bringing unmatched expertise in branded generics, ensuring that high-quality medicines are accessible to those who need them the most. Meanwhile, ORx Pharmaceuticals, a beacon of innovation from Ontario, Canada, comes with a very rich legacy of advancing medical science and creating transformative therapies that improves patients' lives globally. This partnership, ladies and gentlemen, is not just another collaboration, no. It's a fusion of visionary excellence, where Sygen's pioneering spirit meets with ORx cutting-edge technology. Together, they will accelerate the development of innovative drug formulations, one. Number two, tackle pharmaceutical drug security challenges. And number three, improve access to affordable, high-quality medicines in not just Nigeria, but Africa as a continent. The new joint venture, Sygen-ORx Biosciences, it's not just about now. It's not just about the present. It's about the future. A future where healthcare innovation transcends borders. It's not about where you are or your geographic location. Where patients, regardless of where they are, have access to life-saving treatments. It's more like we're bringing Canadian technology to Nigeria's pharmaceutical sector. This venture, ladies and gentlemen, will serve as a catalyst for research and development and drug discovery here in Nigeria. Ladies and gentlemen, today we'll be hearing from key players in the healthcare sector, both scientifically and theoretically, both here in Nigeria and all the way from Ontario, Canada. We'll be hearing from our partners and generally introducing you to this new baby that was birthed some time ago, but today is its naming ceremony. Sygen-ORx Biosciences. A round of applause at this juncture. Thank you. My name is Gloria Olufeko, and just because we're here to celebrate this venture, this new baby, I am not just your compere today. I'm not just your master of ceremonies. Please, permit me to call myself the officiating minister for this beautiful union and ceremony today. So you've met me. My name is Gloria. I think it's at this juncture that you need to meet the person sitting just beside you and know two things in the next 1 minute about that person. It could be their name and what they do. So can you meet the person sitting beside you and say, hello, good morning. My name is Gloria Olufeko. I am an international master of ceremonies. I compare events, and I've compared events in Ghana, Kenya, South Africa, and here in Nigeria. I like it. You don't know who is sitting beside you. You don't know. Thank you. Thank you very much. Thank you. So on behalf of Sygen Pharmaceuticals Limited here in Lagos, Nigeria, and ORx Pharmaceuticals Corporations all the way from Ontario, Canada, I very warmly welcome you to the Sygen-ORx Biosciences Joint Venture Press Conference. Another round of applause, ladies and gentlemen. Please be generous with it. Be generous. Thank you. Thank you very, very much. Ladies and gentlemen, we have people joining us online, so thank you so much to everyone watching. I do promise that you'll be carried along as much as everyone in the room is carried along, so please do not for anything go anywhere. Now, ladies and gentlemen, every great journey, you will agree with me, begins with a clear-cut direction. And to formally set the stage for what is about to be a historic event here today, please join me with a loud cheer and a warm round of applause in welcoming the chairperson of the Sygen Pharma Medical and Scientific Advisory Board, Professor Bose Afolabi.
Good morning, everyone. I have to say that I've just been set up, being asked to speak after the officiating minister, Gloria. Thank you very much for the introduction. My name is Bose Afolabi. As she mentioned, I'm a professor of obstetrics and gynecology at the College of Medicine, University of Lagos. And I am also the chairperson of Sygen's Medical Scientific Board, Advisory and Scientific Board. Sygen and ORx are just in for a treat, and I'm delighted to introduce and welcome you to this press conference launching their collaboration. This is a really well expected and well deserved partnership for Nigeria, because we have these problems of having a pharmaceutical space that still needs to come down to the people some more because of cost, because of efficacy, because of effectiveness, as most of the research that has been done for a lot of drugs, as you can imagine, is done in high-income countries with their own genetics at play. But in this instance, this collaboration is coming together between Nigeria and Canada, although both teams have Nigerian affiliations, to try and ensure that a lot of the generic drugs that we have already are repurposed to be more efficacious for us as a country and as a region, and also to hopefully reduce the costs by the time these medications are repurposed. So it is with joy and delight that I welcome you all. We've gone beyond time, and that's the reason I'm going to keep it short, not because I don't like talking much, but because we've gone beyond time as it is. I welcome everyone, all the dignitaries, all the policymakers, all the great people here, and all of us that are here to witness this really, really exciting event. Thank you very much. Between Nigeria and Canada, I'm very, very happy to be here today, and I welcome everyone. Thank you.
Thank you so much, Professor Bose Afolabi, for that very warm welcome. I mean, I had done my welcome, but I had to bring up somebody whose shoes I'm not worthy to unlatch to do a very grand welcome. So what a way to start and kickstart today. It's such a historic event. And I'm excited because in another 20 years, I'll tell my children that, guess what? Your mom was the MC at such a historic event. Yes, I'm really excited and looking forward to letting them know that. Welcome once again, everyone, to joining us. Welcome to the Sygen-ORx Biosciences joint venture press conference for this morning. Thank you. Moving on very quickly in our event today, ladies and gentlemen, there's a very popular quote that I love a lot. It's by Helen Keller. And she says, alone we can do so little, but together we can do so much. And this quote perfectly captures the essence of our next item on our agenda. When two forces come together, hand in hand, the impact is far greater than what one of them would have done on their own. And today we're about to hear from the CEO of Sygen Pharmaceuticals. He will be unveiling this exciting new partnership. letting us know the objectives and the strategic vision behind it. Of course, what are the milestones, what are the timelines to look out for, and the expected outcomes and benefits of this partnership. Ladies and gentlemen, with a very, very warm round of applause, join me to bring up to the mic the Chief Executive Officer, Sygen Pharmaceuticals Limited, Mr. Charles Ogunwi. I think he deserves a better round of applause. Better.
Thank you, everyone. Thanks for coming. So I have a short presentation, about 10 slides, and I'll try and use this to kind of walk you guys through how we see this from our perspective. So once again, welcome. All right, can I have the next slide? All right, so I think Bosse earlier on gave some context to why we're doing what we're doing today. Largely, this is really more about pharmacogenetics in terms of how, and I'll leave that to the experts. I'm not a science person by any chance, but I think I'm very passionate about the subject, but I will not pretend to be an expert. But I will share with you some of the challenges we have in the marketplace. And I think that will also give everyone here some context. We also have some investors here that are interested in this space. So I will share some numbers. So it's not just a scientific presentation. Next slide. So the market in Africa, which is what we are focused on here, is fast and is growing, but is largely challenged, right? And these are some of the challenges that are stifling the growth of the pharma industry in our region. So we have a drug security challenge. We are heavily dependent on imports. 70% of our drugs in Africa and in Nigeria are imported. That in itself is a major drug security risk. COVID was a perfect example of that, right? This continent was the last continent that Big Pharma thought about when it came down to coming up with solutions for COVID, right? Almost 10 million people annually die from not having access to essential medicines. That is a huge travesty for this continent because largely it's about access and affordability. Now, also, we know other peculiar things to us here. Once you are heavily import dependent, it means you are heavily FX dependent, right? Nigeria's macro is a great example of what's going on right now. With that kind of a situation where you have limited FX supply, it leaves us in this region, in Nigeria and Africa, quite vulnerable, yeah, in terms of us being able to get drugs. Another key factor that you need to look at, and I think this will jump out to many investors and also just to you guys here. In Africa alone, we have about 375 manufacturing companies to a population of 1.3 billion people. That number is abysmal when you think about the number of people here and our production capacity, yeah, to be able to secure our own people. You compare that to China with a similar population, right? And they have 5,000 manufacturing companies to a similar population. You compare that to India with a population of 4 billion people, you have 10,500 manufacturing companies. So for a similar population, right, Africa as a continent has 375. And by the way, more than half of that 375 is in North Africa. So I think those are some of the things that I think, you know, are kind of eye-opening for us in terms of what we need to do here in our continent to secure ourselves. And other key point of fact I wanted to share with you guys that in Africa alone, we have extensive and numerous academic research. There's a lot of academic research in this space that is going on, but quite a few of it has been tied to commercialization, right? We've not been able to have that kind of high velocity of being able to commercialize a lot of the academic research, in the drug discovery and R&D space. And the last point there I wanted to leave you guys with is the fact that if we keep depending on big pharma, right, they are really not incentivized to focus on drugs that are to focus on drugs that solve problems that are peculiar to us in Africa, right? They will look at where they make their money. They will look at which diseases are more prevalent in their own part of the world. So we will always be secondary to them. Hence why this union and this project that we're embarking on, it is critical to us being able to solve our own problems, by ourselves. Some other interesting facts there, but I'll move on to the next slide. But I just wanted to leave you guys with these facts. Now, when we look at this slide, despite the challenges that we have in our continent, right, this slide says a lot. The market is still growing, right? This is the pharmaceutical forecast for the next 10 years in this marketplace. So the sub-Saharan African market collectively is meant to be about 34 billion in another 8 years, right? When you look at West Africa, which includes Nigeria, it's meant to be about 12 billion by 2032. So this is an interesting fact that I think, I wanted to leave some of you guys also with. It's a big and growing market, and it's a market that we need to address. Next slide. So I'm coming now down to Nigeria. When you look at this slide, it tells you exactly what part Nigeria plays in the West Africa slice. So the Nigerian market is growing as well. It's about $5.5 billion by 2032, and it's growing at about 7%. So this is an interesting fact. This is something that I think gives investors confidence that, yes, this is something that we need to look at, and it's something that we need to pursue. Next slide. So I'm going to go into the joint venture itself, but I'm not going to delve into the scientific part. I'm going to leave that to His Royal Majesty, and I think he will do better justice to that part. Next slide. So this joint venture is largely going to focus on three key things. The first thing is for us to develop improved formulations. So we're going to start with existing generic formulations. So we're not starting from scratch. So this is not like a blank slate kind of R&D, right? So there are existing technologies that are going to be applied to existing formulations, right, to improve the efficacy of those drugs. So there's going to be much more of a shorter horizon in terms of how we're going to be kind of churning out the kind of innovation that are going to come out of this collaboration. So high success rate. So it's not like a blank slate type R&D. And we're going to be looking at advancing innovative drug discovery programs outside our first point as well. So we're going to look at things that we can also export, things that will also affect other people outside this region. And more importantly, the last thing for us is driving access. The more we can do here locally, the more we can create access to drugs for our people. The more we can secure our own people, and the less we are dependent on foreign big pharma. Next slide. So this is a marriage that was birthed a couple of months back, but this is just a slide that just kind of gives you context of the strength of both parties, right? So Sygen is more of a branded generics business, right? And ORx is more of an R&D advanced delivery pharma business. And both of us coming together, right, allows us to create this new entity, merging Sygen's commercialization expertise with ORx's R&D expertise. Next slide. So local R&D, I think this is my last and final slide. This is just more of a summary slide, right? And drug discovery based on pharmacogenetics, as Bosse mentioned earlier, is critical to improving access to medicines in Nigeria and in Africa. I'm sure KBC will do more justice to what pharmacogenetic means, so I'll let him speak to that. But 4 key things I want to leave you guys with. One, by doing what we're about to do, we will be able to address local health needs. We're going to be creating medicines that are based on African genetics that work for Africans and solve our own problems, right? We will be leveraging innovation that is adapted to our own environment, right? And ultimately lowering costs, less dependence on FX. And lastly, and more importantly, we will be building the local ecosystem. Because the more of what we're about to do right now, more people are going to come into this space. More investment is going to come into this space. That will allow us to strengthen our own health system in this space. So lots of collaborations are going to happen between academia, private sector, and government. And we're hoping that this will serve as a catalyst for that. Next slide. What is our own vision for this space? So our vision is really, on the long term, leveraging this joint venture as a catalyst to launch Nigeria as an innovation hub. And secondly, we're going to invest in, jointly together, a world-class R&D facility over the next couple of years. And like I mentioned earlier, foster scientific talent in this space. And we have a commitment and timeline there. So our goal is to develop an R&D facility, probably cost us about $5 million, and expand local production capacity, which will cost us about $17 million. But I think what is more interesting is that we'll plan to commence immediately, leveraging ORx's facilities in Ontario. So it's not as if we're waiting for that facility, for the local Nigerian facility to happen. We're going to start this immediately. So Q1 2025, we commence R&D in Ontario. And then hopefully Q4, we'll start to commence some clinical trials. And then by Q1 2026, our goal is to have this world-class integrated R&D facility here in Lagos. So thank you, everyone.
Ladies and gentlemen, when someone knows where he is going, he speaks with much confidence. Another round of applause for the CEO, because he knows where he is going. Thank you very much, Mr. Charles Ogunwi, for that very succinct and well-explanatory presentation. You know that this venture, ladies and gentlemen, it's more like democracy. Because when I was in secondary school, they told me in government that democracy is government of the people, by the people, and for the people. So I would like to say that this joint venture is of Nigerians, by Nigerians, and for Nigerians, and by extension, Africa as a continent. So it's such a beautiful venture, beautiful one. I cannot wait to see the fruition and to see it come to fall. So thank you to our partners, and thank you for allowing us have this merger. Thank you so much. If you're just walking in, welcome to this august and historic occasion. It is indeed an absolute delight to have you, and thank you for choosing to spend your Friday afternoon and morning with us. Moving on very quickly, ladies and gentlemen. In the world of medicine, you will agree with me that working together is like the spark that turns ideas into real solutions. And as we move on in a new chapter for us, it's clear that strong partnerships between countries are key. Now think of it like building a bridge, connecting two sides to create something even bigger. And today, we will be having our next speaker to talk about the partnership between Canada and Nigeria, which is more than just a formal agreement. Ladies and gentlemen, please join me with a very warm round of applause to bring to the mic the Canadian High Commissioner, Jamie Christophe, ably represented by the Canadian Deputy High Commissioner, Mr. Didembolo Zaya Kuyena. A round of applause for him, please. It will be talking about the partnership. You're welcome, sir. Thank you.
Can we give a round of applause to our officiating minister, Gloria? I feel like I thought I was just attending a pharmaceutical launch, but I'm part of this historical matrimony service. And thank you for setting the tone. I'm excited today for a couple of reasons, and I'll go through some of the formalities of that. But first and foremost, distinguished ladies and gentlemen, it is a privilege to be part of today's ceremony for the landmark drug development joint venture between ORx Pharmaceuticals Corporation and Sygen Pharmaceuticals Limited. And I stand on existing protocol, and I thank the opening speaker for his eloquence and as well as business acuity in outlining the direction that this joint venture is going to. I would also like to thank all attendees for gathering today. I think it's not just historical, but I think it's quite critical that there's a particular ownership in curating the particular type of narrative for Nigeria, not just for Nigerians here, but its resonating effect across the continent, but also within the diaspora. Now, first things first, I'm pleased and witnessed this growing relationship with Canada and Nigeria. I've been occupying my current position as the Acting Senior Trade Commissioner for, it's going to be about 12 months. So when we were going around introducing each other, I wanted to quickly kind of show off not just who I am, but also how I've become a savvy and expert on Nigerian cuisine. So mentioning my favorite dishes from egusi to pepe soup and so on and so forth. But that may sound superficial, but you shouldn't be surprised by the Nigerian blueprint that's having an impact globally. So many people are being introduced to Nigerians before they even come to the Nigerian border. That's because you are supplanting yourself in a range of sectors. So one of the key points which I will just mention is the developing and attracting talent. Now, Canada is home to just under 16,000 international students. We're competing with the UK and the US in the attraction of some of the best and the brightest that this country is developing. Now, to our benefit, economically speaking, we understand that many of them are in the life sciences, whether they are biomedical engineers, pharmacists, entrepreneurs who are launching a range of startups. But with this phenomena that we're seeing in Canada, Nigeria being the largest African immigration represented on from sea to sea to sea, one of the things that we're seeing, especially in the global market, is to ensure that Nigeria also inherits the talent and the investment, which makes these types of joint ventures quite critical in the not just global supply chain, but in terms of global market. Trade between countries is not primarily done with commodities. I think we have to understand that It has been, since time immemorial, it's been people to people ties, and to ensure that facilitation. So I know the phenomena of, and we're much aware of it, and we have the data to back it up, of Jakbada. Hopefully I'm pronouncing it correctly. But given that Nigeria has become the second largest trading partner in Africa, that was 2022. In 2023, you became the first. And we're obviously monitoring your current economic landscape because it's in our best interest in terms of Canada. But I'll bring up the second phenomena, and pardon me for my mispronunciation, right? It's Dakbada, is that correct? So it's not just those who are leaving, but those who are returning. So again, we're not just making reference to that in terms of investments, but in terms of talent. So how are we creating the necessary mechanisms for the talented and the brightest who are still here in Nigeria, but some who are also residing abroad in order for us to facilitate that return? So that is going to be quite monumental in growing this ecosystem, not just for Sygen and ORx Pharmaceutical, but also for the industry as well as the ecosystem that's burgeoning here in Nigeria. Nigeria's economic diversification policy well aligns with that of Canada in a range of sectors. We are looking at agriculture, we're looking at ICT, we're looking at oil and gas, we're looking at mining. This past summer, we invited some top-tier executives from Canada to look at alternative energy for top sectors in order for us to invest in. However, one that is going to be top of mind based on today's announcement is pharma. That's quite critical in a range of areas. Speaking to a range of Canadian institutions, educational institutions, they've been purposely and intent on looking to invest in advanced research. Guess where they're looking at? Nigeria, because they've already inherited some of your best students, some of your best faculty members. Now they're looking at, that's not a sustainable model long term. Hence, many advanced economies are looking to invest on the continent, brick and mortar. Because being part of the fourth industrial revolution, one needs not to overlook Africa, but also to consider it long term, given that the growth, particularly in pharma, in Canada, let me just, in terms of numbers, by 2030, the compounded annual growth rate of 7% will help grow us to 142 billion. That's because of an aging population and the expense cost of maintaining a top-tier healthcare system. Now, you already saw the numbers, but I'll remind you, for Nigeria, that is 9.1% compounded annual growth rate, which by this year will be 5.3 billion. That's how our estimates are going and the projections. By 2023, you can only imagine what that number is going to be. So not only Canada, but we know our many allies are highly invested in this. But we want to stand as a partner, and if you permit me to use the term friend, of Nigeria, to see it through not only the many years of its development and its metamorphosis, but also to reach its potential. A lot of pressure is on you in order for you to accelerate in your industry. And you won't be able to do that alone. And so Canada stands as a willing partner and investor in a range of areas, but primarily in the people-to-people ties. So this is a Canadian success story for us, given ORx Pharmaceutical investing. It's not just dollars, but it's talent and ensuring to leverage its facilities and resources to see the growth of the industry here in Nigeria. We believe that this is going to be a template, not just for the pharmaceutical sector, but also for a range of other sectors. So that only means more work for you, but also more work for us. If we truly want to see Nigeria not just bounce back, but to realize its economic potential. because the benefit, again, isn't just within the borders of your country. There's a proliferating effect across this continent, as well as emerging markets. So it's with that, I thank you for this gracious welcome and invitation, and I wish you all the success that this joint venture will bring. Thank you very much.
Ladies and gentlemen, the Deputy High Commissioner said very profound things, but out of everything he said, something struck me. He said, we cannot overlook Africa. We cannot overlook Nigeria. And I'm very sure you heard that too. And I'm very sure that this venture that we're here to celebrate today will bring the focus back to Nigeria and back to Africa, where everyone seeks to get a rich array and vast amount of talent, and they do not need to look anywhere else than Nigeria. Another round of applause for the Deputy High Commissioner, the Canadian. Thank you so much for letting us know that we have your backing strongly. Thank you. To everyone online, I trust that you are having an amazing time. We're having a beautiful ceremony right here, and I do not for anything want you to go anywhere. To everyone just walking in, you're welcome, and thank you very much for joining us at this historic occasion today. You're welcome. Thank you. Moving on very quickly, ladies and gentlemen. Our very next item on our agenda, we've heard from the CEO of Sygen Pharmaceuticals Limited here in Nigeria. I think it's only very imperative that we'll also hear from our partners. Science is the backbone of any innovation, and of a great pharmaceutical breakthrough is science. And understanding the scientific journey behind our innovation is very, very crucial. Our next speaker, ladies and gentlemen, will provide us with a comprehensive overview of the cutting-edge research and innovative technologies that are shaping the future of drug discovery and development within this new venture, Sygen-ORx Biosciences. He will be explaining the research focus areas, the innovative technologies and methodologies being employed, and expected impact on drug discovery and development. Ladies and gentlemen, it gives me great joy and sincere delight and honor to welcome to the mic ORx Chief Executive Officer and the Chief Scientific Officer, His Royal Majesty, Dr. Alexander McGregor. A round of applause for him. Kabiesi, you're welcome, sir. You're welcome, Kabiesi.
Thank you so much for the introduction. First of all, before I get into the nitty-gritty, I'd like to welcome everybody here today. This is not just an occasion to attend a marriage of two phenomenal parties, but also a marriage that has a royal blessing all the way from Ogun State, Ilawa Bekuta. So I pronounce this a royally blessed joint venture. And when I do that, those of us who are Yoruba people know, I will speak in Yoruba so you can understand for the Yoruba people. Oni ti Kábíyèsí bá ti pa àṣẹ gẹ́gẹ́ bí ó ṣe jẹ́ igbákejì òrìṣà. Ọlọ́run Olódùmarè tí mo lọ sílé àṣẹ, and it shall be, so shall it be. I say that because my folks in Canada are watching. They wonder, what is Prof doing on the stand talking all this stuff? But I will tell you this. It's not just an exciting moment for me personally, but I'll give you the background that I've been journeying around the world. I live in 3 continents, and my penultimate, stop was in Canada, where I spent quite a lot of time, developing drugs, developing industries, and more importantly, one thing that stood out for me most was developing human capital. training people to becoming corporate citizens and to becoming participants in the pharmaceutical industry. So I didn't know that that would come to play for my mother country here in Nigeria, because as I see the challenges of Nigeria today, twofold: technology deficits, and secondly, human capital deficit. When I say human capital, I don't mean people. We have a lot of people in Nigeria. We have over 200 million people in this country, but we don't have knowledge-based professionals who can actually reduce scientific knowledge to practice. So when this opportunity came, I said, oh, God has prepared me for this journey, and I didn't even know. But I'm here to speak to you about the ORx and Sygen joint venture, which is a phenomenal and one of a kind. I will say it wholeheartedly that Canada has never done this before. Perhaps they've done it before, but not at this scale. As the Deputy High Commissioner said, this could serve as a template for most of the future joint ventures that we need. Let's take a look at what's happening. Canada has a disproportional aging population. We need young people in Canada, otherwise we're going to be extinct. So we've been making all these attempts to bring families into Canada, have children, so they can repopulate the country. The second problem was Canada has challenges with health. As you get older, you're going to need more drugs. You know, you can't help it. So our industry in Canada had to tackle that challenge. I was happy to say I was one of the people who assisted the country to actually engage in research and development training that actually helped to tackle it. Now let's look at Nigeria. We could flip the coin and say we have a disproportionate youth population, younger population in Nigeria. Yes, we have aging population as well, but not the same as Canada. So our challenge is how to enable our younger people to become better citizens, to be able to contribute in a positive way to what is happening globally. Now, what we don't have in Nigeria is technology, access to technology. We have a lot of people, we have access to education is not a problem because the universities are there. And I want to make very clear, there's a difference between university education and having, a knowledge in a technology that you can use to actually develop industries. So I say this because this particular union between Sygen and ORx, it was carefully crafted to ensuring that everything we need for the success, immediate success, and future success is taken care of. The first part of it is access to technology. We call it intellectual property. In North America, we have ways by which we ensure that we can develop drugs, not only drugs, that we can develop new advancing medicines. And the driver for this is IP, what we call a background intellectual property, as well as foreground intellectual property. And this union is leveraging ORx's intellectual property that have been created over the last 30 years. We have a suite of IPs that we use to literally develop a range of drugs without having to labor over things. One of the impediments to drug development is time. It takes time to develop drugs, especially if you want to develop a good drug. But technology is advanced, and to the point that people like ORx and myself, we've developed what we call platform technologies based on background IPs. It's like developing a recipe for making a variety of soups. So the background for that recipe is there, is in a sachet. So now you want to make goat pepper soup. You put a sachet in a pot. The only thing you need now is to go and find the goat. Once you find the goat, you dice it up, you throw it in, you have goat pepper soup. Tomorrow you want to make chicken pepper soup. Okay, the same sachet. You put it in water, try it and test it. And the only thing you need to find out is the chicken. And then you see how fast it gets? Rather than the old way where you have to go to the market store, go buy tomatoes, go buy onions, go buy this, go buy atagung, all that stuff, and try to start. No, that's old school. So intellectual property base allows you to leverage platform technologies that you can use and direct it towards a variety of drugs. Now, as a professor of biopharmaceutics, I can say that I don't call it cheated a bit, but I've used a lot of my graduating students to validate my technologies. I've graduated over 6,000 students since 1992, and I'm glad to say majority of them are vice presidents and presidents of pharma companies today. Most of the large pharma companies, if you mention Professor McGregor from Toronto Institute of Pharmaceutical Technology, say, oh, that's a guru. Some of them think I'm a white man, by the way. Until I show up and the eyes just light up, I say, oh, and I say, not only a black man, I'm also a Nigerian. So, wow. Well, there you go. So we have the ability to change the narrative. And I call this kind of union a paradigm shift from the old ways of looking at Nigeria. Okay, someone talked about multinational leaving Nigeria because it's no longer economically feasible for them. Of course, they don't have a stake in the country. They don't have a stake in your development. They only came here to make money, and that's it. And when the numbers don't look good, they'll leave. Now, I don't blame them. I will even advise them to do the same if I were them. But if every country has to develop, and I'll say this because of my own personal experience, 2002, 2003 was my first time I went to China. I was invited as an expert. And at that time, China did not have intellectual property to develop drugs. In fact, some of the facilities are so abysmal that, I walk in there, I want to run right back out and say, what are you doing here? So I remember Beijing in China. The mayor of Beijing invited me over. I went to a big company there called Beijing Double Crane Pharmaceutical, and they didn't have any IP. They thought making drugs was simply finding raw material and just throw starch and grind it, and whatever comes out, and that's how it is. But they knew that has to change. And we, as a group from my team in Canada, we went to China. Not only did we transfer technology, we also enable a center of excellence that was able to train the people to understand what we've taught them so they can stand alone. So one of the challenges we have with multinationals is that they will come to your country, they'll bring the products, they'll run the business, but they will not train you or let you know how to do it by yourself. I'm sharing this experience because China today do not depend on the West for anything. They learned, and I'm glad to say I was one of the ones that actually helped open the eyes of the Chinese government to this type of thing. Today I can go to China, I don't need a visa. That's one of the perks they gave me. I wish they gave me more money back there, but there you go. But I'm saying this because knowledge is universal, science is universal. It's not restricted to a geographical zone. Nigerians are brilliant, we're excellent, we're all around the world. And unfortunately, enabling environment is all we need to become good and better. And I always argue the best enabling environment for Nigerians is Nigeria itself and Africa. But we need to realize this is an industry that requires dedication, commitment. It's not just to come in and say you want to make money, but you want to be able to solve the challenges of the people. So our get into some of the science a little bit. I don't want to bore you. I was asked to do a slide presentation, and I told him I have about 120 slides, and I said, well, that's not going to be helpful unless you're students of pharmacy. You wouldn't understand it, but I'll break it down in layman's terms so that you can understand it. Value proposition is as follows. Africa has peculiarities. When we're developing drugs, there's something called pharmacogenetics. That is, every human being is predisposed genetically to certain things that can affect drug metabolism. You know, the way drugs are metabolized, so that, you know, some drugs you take them, they are metabolized into active agents. Some are taken as prodrugs, they are metabolized. So different predispositions, you know, changes certain peculiarities about our enzyme systems that can allow us to metabolize drugs differently. When you metabolize differently, you're going to create different active principles or different extents of active principles. And then things will start changing when you're looking at interaction at the site of action. We call it pharmacogenetic differences. We actually do that when we're developing drugs in Canada, United States, in China. I developed drugs for China, and I had to repeat my research with Chinese population to show that what I developed in Canada will actually work for them. Now, interesting revelation. They don't always work. And because we're very different genetically, right? Second of all, we're different in what we call a body mass index. The BMI is different. And when we're developing drugs, we tend to look at you know, your weight and your body frame and your size. And when we're choosing populations for research, we choose population based on who is sponsoring the research. So in Canada, GSK sponsors the research. They say, I want to make the drug for people in Canada or Europe. So we'll pick maybe 80% of the population would be Caucasians. 20% will be maybe some native Indians and some people, but suddenly not people of our color, not people of African descent. So when it comes to drugs working, they don't always work. Even when you import those drugs that were already approved in the United States, in Canada, in Europe, you import them into Nigeria, there is no assurance that those drugs will work. When I say work, I mean efficacy. I don't mean that they don't have the content. The content on the label says what it says, and when I test it, it says, you know, that's what it is. But a drug is not about just the content. It's about the delivery system. What I mean by that, when the drug dissolves in your body, how it interacts at the target site, how it's absorbed through a gastrointestinal tract, you know, how it's metabolized, you know, and all of those things are technical. I won't get into too much detail on it, but they don't always work because they were not designed and developed with your population in mind. But that's what we import, because we go out, bring them in. But I've learned over the years, and with the little exposures that I've had, when I go to different countries, I repeat, you know, what we call a bridging studies. We bridge the study. We say, okay, we've done the study in Canada, it works, but I'll go to China, I've got to do my bridging studies to show that it works equally as well in the Chinese population as well as it did in the Canadian population. But as I said, they don't always correlate. The correlation is a revelation. It allows us to now modify the formulation, modify the doses, modify what will actually work in those people. And that's how today you go to China, you see doses of drugs that are different from what they manufacture in, let's say, in United States or Europe. You see, and not just the dosing regimens. You know, you see, you know, in North America we have a culture, we call it breakfast, lunch, dinner culture, right? Nothing in between. In some countries, no breakfast, heavy lunch, and then dinner. Nigeria, you can probably count about 5 or 6 different meals that you take throughout the day. But But when we're doing our studies in North America, we do what we call a food effect, because the food that you consume affect the way the drug also works. Now, when I do my studies with food effect, I'm looking at the food effect based on North American system. So when we do that, and then they're trying to prompt me to say, do you want me to get into science? I'm happy to do that. No? But let me fast forward. The food effect helps us to understand that we need to repeat studies based on the Nigerian population. And when we do that, it also helps us to produce drugs that work for the people here in Nigeria. So the ORx Sygen, we're leveraging technologies. We're leveraging know-how. There's IPs, which are intellectual property patents. There's also trade secrets, and there's also know-hows. So those things in combination allow us to immediately hit the ground running, produce drugs that work in Nigeria for Nigerians, for Africans. I think if something works in Nigeria, we can always say it will work for most African countries, because we're all genetically and demographically, we're kind of similar in our ways. But on top of that, we bring in quality assurance. We have something we call quality by design. So we build in quality assurance into the way we actually develop the drugs, so that when you produce a drug, it acts consistently and it works consistently and is quality assured, bringing us to the same standards of therapy that we expect. So Nigeria shouldn't be a country where you look at substandard drug. It should be a country where you can produce any drug that works all around the world. So thank you very much. If you have any questions further, I'm happy to speak, but this is a great union, and everybody can see that this is also great news for Nigeria and for Canada by extension. Thank you.
Thank you. Please, can we make that applause louder for His Royal Majesty, Dr. Alexander McGregor, the Chief Executive Officer, ORx, and the Chief Scientific Officer. I mean, if we allowed Kabiese, we'll go on, and we'll even delve into science here today. Thank you, Your Royal Highness, sir. Thank you so much for... Ladies and gentlemen, it gives me great delight just before we move on in our next item to recognize the presence of a Royal Highness, Olori Dr. Molara McGregor, the Olori of His Royal Majesty, Dr. Alexandra McGregor. Is he here now? Okay, she's not here yet. Okay, please, just a celebrating absentia. Okay, she will join us and I'll recognize her. Moving on very quickly, ladies and gentlemen. Drug discovery can be rather complex, and whilst we are at it, we must look to those that safeguard our integrity and the quality of our work while we do drug discovery. Now, who better to illuminate this path than the one with the keen eye of a scientist and the wisdom of a seasoned regulator? She will delve into the opportunities within emerging markets and how successful R&D collaborations can unlock new frontiers in drug discovery. Her topic is emerging markets, successful R&D collaborations, and their impact on drug discovery. Ladies and gentlemen, it is my absolute delight to bring to the microphone the Director General of the National Agency for Food and Drug Administration and Control, NAFDAC, Professor Moji Adeyeye. A round of applause for her. Please, let's sustain the applause. Let's sustain the applause for the DG.
Thank you. Thank you very much for this occasion, for inviting me to witness the launching of a relationship between ORx and Sygen. This is one of the things that NAFDAC looks forward to. But let me start with the protocol. I have the KBAC in the room. So I want to recognize our KBAC, Professor McGregor, who I've known for maybe 17 years or so. What is happening today is phenomenal. And we will realize it in about 3, 4, 5 years. We don't know now. I was watching a video on WhatsApp, and it's a Kenyan lady that was oozing over Nigerians. She said, I think the video was about 7 minutes or so. She said she has never seen a group of people like Nigerians. That people have to study us to know why we are so smart. That you go into the medical field, you will see Nigerians, legal Nigerians, technology Nigerians. And she went on and on and on. This is a Kenyan lady. So what the KBAC was talking about in terms of the giftedness that we have in this country, I just want to put it in perspective. We started a journey in NAFDAC 6 years ago to look inward as to our capability, what we think we cannot do, and how to get there. We started with the manufacturers, that there must be a change in paradigm to become less addictive to foreign-made products. Less addictive. Because when you have addiction, it has to be treated radically. That was what we started 6 years ago, in terms of telling ourselves that we can do it. We started using different regulatory directives to encourage introspection, looking inward. If somebody has told us for decades that we cannot do it and we've bought into it, I wanted that paradigm changed, and it has changed. It's changing. We are not there yet. We started 5+5, which is you have been importing and importing. Your last imported product will be your last imported product if we can make those products, such products, in Nigeria. We started the ceiling 34, putting some products under ceiling that people cannot bring in because we have installed capacity for such. For Sygen took a bold step a few years ago to start from the scratch, using an old facility, turning it into workable GMP based or driven facility. When I chatted with the CEO of Sygen, I became even more encouraged. But when this partnership came in, and knowing the background of Dr. McGregor, I knew that we are really embracing that change in paradigm. A manufacturing facility cannot be stronger than the regulatory agency. A manufacturing facility cannot be stronger than the regulatory agency. The changes we are observing now in the industry is a reflection of the changes that are taking place in NAFDAC. Because if we are not strong ourselves, we cannot guide
the manufacturers on how to use international standards, how to use the quality management system approach to ensure that the products that our people are getting are of quality, they are safe and efficacious. So it is my honor, my pleasure to witness this partnership between Sygen and ORx. Again, you have to wait 2, 3, 4 years, because when you are developing a new program, it's not overnight. And sometimes we are not patient in Nigeria. We just want something on the pages of newspaper. It doesn't work that way. When you are developing products using technology, NAFDAC encourages technologies. We are technologically driven. About 70% of our processes are digitized. When you have digitized system, you are more transparent. There is less corruption. There is better productivity or better outcomes. You want to stick with standard operating procedures. So again, I wish Sygen and ORx great journey in this wonderful, wonderful relationship. Thank you very much.
Ladies and gentlemen, the manufacturing facility cannot be stronger than the manufacturing agency. But the DG of NAFDAC has let us know that we have her support. And she said another 4 or 5 years, I'm sure she will be back to give us a very loud applause, because we would have done very well. Ladies and gentlemen, another applause for the DG of NAFDAC. It's so refreshing to know that we have NAFDAC support. Thank you so much, ma'am, for the incredible work you do at NAFDAC. Thank you, ma'am. Moving on, ladies and gentlemen, I did mention earlier that I would recognize a very important person that walked in. Well, she's here now. Please put your hands together to welcome to our presence Her Royal Highness Olori Dr. Omolara McGregor, the Olori of His Royal Majesty Dr. Alexander McGregor. Thank you so much, ma'am. You're looking queenly as always. Thank you. Moving on quickly, ladies and gentlemen, in our itinerary for today. Investment is the lifeblood of innovation. And in Nigeria, the climate for investment is growing day by day. Our next speaker will enlighten us on the opportunities that lie within Nigeria's pharmaceutical sector. And as we explore these avenues, we see not just potential investment, but the seeds of future breakthrough for us that will benefit not just Nigerians, but by extension, Africans at large. Ladies and gentlemen, speaking to us on enhancing Nigeria's investment climate, opportunities in the pharmaceutical sector, is the Managing Director and the Chief Executive Officer, Nigeria Investment Promotion Commission, Aisha Rimi. A round of applause for her. Please. You're welcome, ma'am.
I'm not a managing director. I manage other things, but not. So you have to forgive me. I'm from Abuja, and we're very, very big on protocol, as Prof will know. But I will keep it short. I will rest on existing protocol, but you will please allow me to recognize His Royal Majesty, Professor McGregor, and the beautiful, glamorous, regal Olori. My big sister and auntie, Professor Adeye, and I just ran into an old friend, Prof. Bosse. We were in school together, so it was a pleasant surprise to see her. And of course, the Acting High Commissioner, Mr. Kiena. Charles, my dear old friend. Ladies and gentlemen, good morning. So my name is Aisha Rimi, and I think in another light, apart from being the CEO and Executive Secretary of the Nigerian Investment Promotion Commission, I've been called the Chief Marketing Officer. So, and I take that very seriously. So I was asked to speak this morning about enhancing Nigeria's investment climate and the opportunities that are in the pharmaceutical sector. I will speak broadly, and I will speak about the pharmaceutical sector as well. So I will go back again and start and say that I'm very, very pleased to be here this morning for several reasons. One is that Charles is a dear old friend, and I'm so happy with how far he has come on this journey. And in my previous life, before I took this position, which is about 10 months ago, I was a corporate lawyer. And I spent my life, over 30 years, doing joint ventures, mergers, acquisitions, promoting investment and stuff. So for me, it's actually very wonderful to see a real life marriage. Or is it birth? Where are we? And the royal blessing, everything. It's all, yes, everything is here today. It's a celebration. And in this new role, of course, I have been charged with the responsibility of promoting, attracting, and facilitating a form of medical care and support. The pharmaceutical industry presents a potential multi-billion-dollar opportunity, which is vital for improving healthcare across the country, enhancing the quality of life for millions of Nigerians and Africans, saving lives and contributing to the overall well-being of our society. We acknowledge, we're very honest people, we acknowledge that there are challenges that exist in the industry and you know, counterfeit drugs, high cost of raw materials, imports, a reliance on imports for active pharmaceutical ingredients, and so on. But this government and this administration has made significant efforts to address these challenges. Prof is here today. She has talked about what NAFDAC does. There are other agencies, sister agencies, that support the work of this administration, like NDLEA, which battles counterfeit drugs as well, and the FCCPC, which is the Consumer Protection Commission. So on our part, as the Investment Promotion Commission, like I said, we have the mandate to not only promote and attract investments, but to actively support and assist companies and investors in the country. Our agency is actually primarily responsible for administering what is known as the pioneer status. A lot of companies actually, I found, don't know that this exists. And it gives tax waivers and incentives to companies, provided they meet the very rigorous and prescribed criteria. I checked just before I came in, and I think we have granted 9 such waivers to, yes, in the last, I think since 2017, to 9 companies. So this waiver works by giving incentives, tax benefits for 3 years in the first instance, and then renewable for another 2. So you might want to look into that. As we're all aware, this current administration has an agenda that's focused on harnessing the vibrancy of the significant youth population, which has been talked about, generating employment, revitalizing our industries as well. So the opportunities that today's milestone presents immediately tap into all of these focus areas. Jobs will be created, talents responsibly channeled, and healthcare improved. I don't think it's a coincidence actually that Kabiyesi is from Ogun State, which I believe has the highest number of tertiary institutions in the country and universities. So, I mean, that in itself is just a great coincidence, where we've seen that Nigerians have produced and continue to produce well-educated youth with the potential to contribute significantly to this sector. R&D, as we know, is very important, and this is an area where investments can be made and are being made today. Leveraging intellectual capital. By investing in R&D, we can develop homegrown solutions, encourage innovation, and enhance our competitiveness on a global scale. So a manufacturing facility that we hope will come out of this, I think, in the next 2 to 3 years, will offer a wealth of opportunities across the value chain, with, of course, substantial room for investments in the supply of active ingredients, production of packaging materials, and fabrication of machinery and equipment. Current facts and figures suggest that local pharmaceutical manufacturing can only meet about 25% of domestic demand. Yes, I'm right. To a pessimist, this is a major challenge. But for me, being an eternal optimist, this is a huge opportunity. These opportunities must also be juxtaposed against the backdrop of the West African sub-region. We can't just look at Nigeria. When you look at Nigeria, you have to look at the sub-region, and that automatically opens up a market of another 400 million odd people. Recently, and I don't know if people are aware, we have the Africa Continental Free Trade Area Agreement. So that again opens up the market to the rest of the continent. And if I'm not mistaken, that's about 3 billion odd people. Let me talk about my organization, my agency. We have an advocacy and policy department. In this department, we work with all stakeholders to ensure that the business environment continues to evolve to meet international best practices, whilst acknowledging the importance of supporting our local industries and the economic realities. We work with all the state investment promotion agencies where you might also want to explore, because some states also have additional benefits or incentives that they offer. So things don't need to just happen at the federal level. So we encourage Sygen and ORx to consider building outlets or looking into other states to expand their footprint and maximize the economic benefits that lie across the country. We will also, and Prof will agree with me on this, we will also encourage this partnership to explore alternative medicine alongside conventional pharmacology, if that, yeah. We've seen countries like China, India develop their own traditional medicines, Ayurvedic medicines, and incorporate that into their healthcare systems. Nigeria, as we know, has an incredible heritage and biodiversity that is an opportunity that needs to be explored. So from my position, from where I sit, I would like to see this pharmaceutical sector in Nigeria achieve self-sufficiency in the supply of quality and affordable medicines, not just for the country, but for ECOWAS sub-region, like I've said. And I also happen to chair, by virtue of this position, the investment promotion agencies of West African states. So I would be more than happy to take this message across the region. This government, and Prof is here again with me, is making huge efforts to create a more favorable investment climate. And I want to assure you that we are very intentional about removing any and all obstacles that you may come across. We have, in my office, we have 2 floors that house 16 different government agencies. So when you're looking, including NAFDAC, so when you're looking to license your products, to deal with regulators, and you don't have to go from office to office, you can just come to us. We call it the One-Stop Investment Center. With the right partnerships such as this, we promise that we will encourage, we will support what we call the responsive, inclusive, balanced, and sustainable investments. And I think this joint venture today is a shining example of what can be achieved when international expertise, brain gain, that's as opposed to brain drain, local knowledge, joint resources, and a shared vision coalesce. So congratulations to everyone here this morning. Congratulations Nigeria, Canada, Sygen and ORx. Thank you very much.
Ladies and gentlemen, can we please be generous with another applause for her? Please, another round of applause for the CEO Nigeria Investment Promotion Commission. There's a saying that when you go alone, you go fast, but when you go with people, you go far. It's really interesting to know that we have the support and backing of NAFDAC and, of course, Nigeria Investment Promotion Commission and many other bodies that will come along with us on this journey. And so the future is bright. I see a silver lining in the cloud for us. Another round of applause for this venture that was just named today, please. Thank you. Thank you very much. Just before we move on to our final presentation for today, we would like to have a quick photo session with our speakers before they exit. Thank you very much. And of course, with the CEO, His Royal Majesty and Her Royal Highness, our Deputy High Commissioner, sir, would like to have a quick photo session with you and the Director General of NAFDAC. Thank you. Pressman, please, quickly. Can we do this quickly? Here. Thank you. Yes, thank you very much. Before we have our final session before we go into the questions and the answers. So, Pressman, please, let's make this as snappy as possible. Thank you. Yes. I was about to say that. Okay. Thank you very much, ladies and gentlemen, for staying till now. It's truly been an amazing time, and I know that this has been worth your time. We still have one more session to go, and then we'll move into the question and answers, where we get to take your questions and answer all of the questions you might have on your mind as regards this new venture that we've just named today. To everyone still watching online, we're having a quick photo session right after we move on to the last presentation for today, and then the Q&A session. My name is Gloria Olufeko, and I'm the officiating minister for this beautiful ceremony, just in case you're just joining us. Thank you for joining us this afternoon. We're delighted to have you. Thank you very much to the DG of NAFDAC for gracing this occasion, and many, many thanks to Aisha. Thank you so much, ma'am, for gracing this occasion. Thank you. All right. Moving on swiftly, ladies and gentlemen, to our final presentation for this ceremony, which we celebrate today. Behind every great innovation is the support that makes it very possible. And development finance plays a very crucial role in turning ideas into reality. And the Bank of Industry has long been a pillar of support for Nigeria's burgeoning industries. And today we are honored to hear from its MD/CEO, who has sent an able representative. It will discuss how the Bank of Industry is empowering pharmaceutical innovation through strategic development finance, helping to build a brighter and healthier future for all of us. Ladies and gentlemen, representing the Managing Director and the CEO of Bank of Industry, Dr. Olasupo Olusi, is one of the Executive Directors at the Bank of Industry, Dr. Issa Emmanuel Omagu. A round of applause for him. Let's sustain the applause till it gets here, please. Thank you. Thank you so much, sir.
Good afternoon, everyone. I'm Dr. Issa Omagu, and I'm presenting Dr. Olasupo Olusi, the Managing Director of Bank of Industry, who is unavoidably absent. He has been in Abuja for a couple of days. Before I read his speech, I'm wearing like 4 hats. One, as someone who typically my division oversees health and pharmaceuticals, and we're very passionate about this particular space. Also, as someone who is presenting my MD as far as this particular speech is concerned, and also someone who was there, if Charles remember, at the beginning of this Sygen story. I used to be in GT Bank, and I was the divisional head of commercial banking in Lagos Mainland. And Nigerian German Chemicals used to report to my division, and we did a lot of legwork, and I'm happy that today not only has Sygen survived, but has now gone global and helping Jakbada to become a reality. So, Your Royal Highness, I'm not sure what the protocols are, but Your Royal Highness and Your Royal Highness, and all the distinguished that are present, I'd like to stand on the existing protocols. I want to do this speech on my MD's behalf. So permit me to just basically go through what has been transcribed for him. Distinguished ladies and gentlemen, it is my pleasure to be here today to give the keynote address at the formal signing ceremony between Sygen Pharmaceuticals Limited and ORx Pharmaceuticals Corporation. Industries in Nigeria and across the world have always been drivers of growth and development, and as such need to be prioritized in any economy. Today, I am pleased that we are consciously moving towards that direction and ensuring that businesses in Nigeria get the necessary support to drive growth and development. As you know, partnerships like this are critical to the level of growth an organization can achieve. It ensures that businesses continue to evolve, which leads to financial viability and in turn attracts more investors. Nigeria's healthcare sector has experienced growth in recent years because of the massive pool of diverse and talented people, increased access to technology and process improvement, purposeful leadership, and increased investors' interest. The sector has constantly devised innovative solutions to some of the most pressing medical challenges in Nigeria, as can be seen during the Ebola and COVID-19 pandemics. While there is a lot of potential, we must continue to work together to build a robust ecosystem that nurtures and empowers businesses in the sector. A system that bridges the gap between innovative ideas, and access to funding, a system that cultivates a culture of resilience, and a system that harnesses the power of technology to amplify impact across the healthcare space. The success of Nigerian businesses lies not in isolation, but in collaboration with one another, such as this. It is indeed an honor to stand before you today to discuss a topic of paramount importance to our nation's health and economic well-being: empowering pharmaceutical innovation, the role of development finance. As we gather here, we are reminded of the critical role that the pharmaceutical sector plays in ensuring the health of our people and the growth of our economy. Today, I will share insights into how the Bank of Industry is spearheading efforts to drive innovation in the vital sector through strategic development finance. The importance of the pharmaceutical sector cannot be overemphasized. Nigeria, with its growing population and dynamic economy, is at a critical juncture where the health needs of our people are evolving rapidly. Our nation faces a dual burden of communicable and non-communicable diseases. Our nation faces a dual burden of from malaria and tuberculosis to hypertension and diabetes. The pharmaceutical industry is the cornerstone of our healthcare system, providing essential medicines and treatments that save lives and improve quality of life. However, for too long, our pharmaceutical sector has been heavily reliant on imports, leaving us vulnerable to global supply chain disruptions and foreign exchange volatility. This dependence not only impacts the availability of life-saving medicines, but also stifles the growth of local industry. It is time to change the narrative, and development finance is the key to unlocking the full potential of our pharmaceutical sector. What is our role as a development finance institution and as Bank of Industry? Development finance institutions such as Bank of Industry are uniquely positioned to bridge the gap between the needs of the pharmaceutical sector and the resources required to meet those needs. Our role is to provide the financial muscle and strategic support necessary to drive innovation, build capacity, and ensure that Nigeria becomes self-reliant in the production of essential medicines. Some of our strategic interventions over the last couple of years, and by the way, about 60 years old, this one is not on the script, are as follows, and still ongoing. 1. Financing R&D and manufacturing. At the heart of pharmaceutical innovation is research and development, R&D. The Bank of Industry has committed significant resources to financing R&D initiatives across the country. We are providing funding to companies working on innovative drug formulations, particularly those targeting diseases that are prevalent in Nigeria. Additionally, we have supported the establishment and expansion of manufacturing facilities, supported the establishment of state-of-the-art technology, its improvement, ensuring that our local pharmaceutical companies can produce high-quality medicines that meet international standards. 2. supporting SMEs and startups. Small and medium enterprises, SMEs, are often the driving force behind innovation, particularly in the pharmaceutical sector. However, these enterprises frequently face challenges in accessing the capital needed to grow and innovate. BOI has launched dedicated funds aimed at providing concessional loans and equity investments to pharmaceutical companies, SMEs. Our goal is to empower these companies to expand their operations, invest in new technologies, and bring innovative products to the market. Enhancing regulatory compliance. One of the key challenges faced by Nigerian pharmaceutical companies is meeting international regulatory standards, which is essential for accessing global markets. The Bank of Industry has stepped in to provide funding and regulatory services focused on improving quality control and ensuring compliance with global manufacturing practices, GMPs. By supporting our companies in meeting these standards, we are paving the way for Nigerian-made medicines to be recognized and accepted globally. Building capacity and collaboration. The development of our pharmaceutical sector is not just about finance. It is also about building the capacity of our people. BOI has partnered with universities, research institutions, and international organizations to provide training, technical assistance, and knowledge transfer. We're also fostering public-private partnerships that bring together the best of both worlds, government support and private sector dynamism, to accelerate the development and distribution of innovative treatments. So what is the impact of BOI's initiatives? The impact of this strategic intervention is already being felt across the country. We have seen a significant increase in local production of essential medicines, reducing our dependence on imports. Our pharmaceutical companies are now producing a broader range of high quality drugs, and we are witnessing the emergence of new innovations that have the potential to revolutionize healthcare in Nigeria. Sorry. Moreover, these efforts are contributing to job creation and economic growth. The pharmaceutical sector is becoming a major employer, providing skilled jobs in manufacturing, R&D, and quality control. This not only strengthens our economy, but also enhances the quality of life for all Nigerians. So looking ahead, as we look to the future, the role of development finance in empowering pharmaceutical innovation will become even more critical. The challenges we face are significant, but so too are the opportunities. The Bank of Industry is committed to continuing the support for the pharmaceutical sector, working hand in hand with the government, private sector, and international partners to build a resilient and innovative pharmaceutical industry in Nigeria. In conclusion, His Royal Highness, ladies and gentlemen, I want to reaffirm the Bank of Industry's dedication to empowering pharmaceutical innovation in Nigeria. Through strategic development finance, we are laying the foundation for a healthier and more prosperous nation. Together, we can build a pharmaceutical industry that not only meets the needs of our people, but also positions Nigeria as a leader in pharmaceutical innovation on the African continent and beyond. Thank you, and let us continue to work together to achieve our shared vision of a healthier and more self-reliant Nigeria. Thank you very much, and God bless. But Gloria, calm down. She didn't tell me how many minutes I have, but now I'm free to say what I want to say in my own personal capacity. Okay, so BOI is, like I said earlier on, is about over 60 years old, and we had the new leadership. We had leadership change sometime in October last year, or in fact November 1st last year. And one of the things that's happened is that we've been lucky with quality of leadership over the years, and that has helped the bank to really be different among DFIs, not only in Nigeria but in Africa. And I think there's something that the Royal Highness said when he was making his speech about not just trading pharmacies but also human capital development. I always say in my role as a leader, business leader, that if you fix the people, you fix the business. So emphasis on human capacity development. So I think we have the right set of people, and I think leadership is doing everything possible to make the people to really add value, in terms of value creation and ultimately value capture and delivery. In the last couple of months, we've come up with 6 themes as a bank beyond our vision, mission, objectives, and mandate. 1, SME is central to it. So one of the thematic areas we're looking at is SMEs. 2, we're looking at the youth. We're looking at gender. And in most cases, when we say gender, we're talking about women. We're looking at digital economy, infrastructure, and climate action. Those are our 6 thematic areas which ride on our existing vision, mission, objectives, and mandates. As far as Sygen is concerned, without honestly disclosing too much information, BOI is working with Sygen currently on its expansion plans. And I think, like I was discussing with Tunde Ajala earlier on, the key man that oversees relationship in the bank, this collaboration even now makes the risk profile more tolerant because of the quality of people that are coming together to solve this collaboration. So it's a whole lot easier to even provide funding. So we're supporting expansion, and we're supporting more expansion, and most of the things that that was said in this speech aligns with Charles's presentation and the Royal Highness's presentation. Quality, human capital. The need to have bespoke solutions for our own local problems. And I took copious notes when you're talking about pharmacogenetics and the need to even focus more on drug delivery system and why we must do our own drugs that will fit our own genes instead of relying on all these Caucasian solutions. So honestly, I think it's a brilliant one. I'm so happy that this is happening today, and we're trusting God that it's only going to get better, and BOI will be there all the way to the glory of God. Thank you.
Ladies and okay.
I'm not ED yet. I'm general manager, so that.
Please, ladies and gentlemen, please give a very warm round of applause to the general manager, Bank of Industry. Thank you so much, sir, for letting us know that we have your support. Please extend our very warm greetings, of course, to the MD CEO of the Bank of Industry himself. Please, will he hear, sir? Please ensure he hears that we're extending our greetings. Ladies and gentlemen, it's now time for your questions and your thoughts. The reason why we're gathered here today, it's a press conference, and we're here to hear from you. And this session is your chance to talk directly to the MD CEOs of the 2 companies coming together for this joint venture. Okay. Of course, we have Charles Ogunwuyi, the MD CEO, Sygen Pharmaceuticals Limited here in Nigeria. He has taken the seat already. And His Royal Majesty, Dr. Alexander McGregor, the MD CEO of ORx Pharmaceuticals Corporation, Ontario, Canada. You're welcome, Kabiyesi. So this is your chance. Thank you, sirs. Please be seated. This is your chance to ask every question you can. Science, strategy, teamwork, framework, timelines, and all of that. Let's discuss how we can shape the future and how we can bring to fruition what we've started here today. Gentlemen of the press, if you want to ask a question, all you have to do is to raise your hand, signal to me, and I'll give you a number. I will be moderating this so we can have a put together and compact session. All you have to do is raise your hand. I give you a number. Then you tell us your name and the media house you work for. And you go straight to your question. Please, let's not take too many questions. One question, tell us what the Lord has done for you, and you go on, all right? So I will come down to you. Can I have your numbers now? Anybody? Please wave to me so I can take your numbers. Please feel free to ask any questions about this joint venture. We've talked, okay, 1, sir. Yes, I got 1. Yes, 1. Huh? I didn't. Oh, Kadesh, you're talking to me. 1. Any other? Going, please. 2, 3, 4. Because I wouldn't take any questions of, oh, Gloria, I forgot. I have a question now. 4, 5, 6, and 7, 8. 2 more because we're taking just 10. 2 more. Who are going to be my last 2 people? 2 more. So 8 questions, and that is it. I wouldn't take any more. Okay. Number 1, sir. Please go ahead. Your name and then. Thank you.
Thank you very much. My name is Dayo Folarin. I'm one of Kabiyesi's Are. I would like to find out from both CEOs what is the direct impact in terms of how cheap are we looking at drugs? The affordability of drugs for the African continent, not only Nigeria.
Hello? Okay. I think if you go back to what KBSC said earlier, so I guess a simple question is pricing wise, right? I can't give you a number. But I think conceptually and strategically, the impact of pharmacogenetics, right, as a tool to develop our own drugs makes us way more self-reliant, right? So when you have less dependence on FX, right, you are less dependence on imports. What does that mean to your local market? It means things are much more affordable here. Now, when you also look longer term, right, because what he and I are trying to do is to serve as a catalyst for this industry, right? So you look 5, 6, 7, 8, 9, 10 years from now, this is going to mushroom, right? So you're going to have many more collaborations, many more people are going to come into it. So exponentially, what does that do? It continues to drive down cost and make things more affordable, not just for Nigeria, but for the continent as well.
Amazing. Okay, number 2 quickly. Let's make this as snappy as possible. Your name, where you work, and then your question. Okay, we didn't hear you.
It's not what. Thank you very much. Bola Omoni Jones from the UK. I'm a consultant, a pharmaceutical consultant. So thank you very much for the amazing presentations. I was really fascinated to see how Sygen and ORx have come together and the strategy as well as vision going forward. I was equally impressed with the presentation from your experience in Canada, especially looking at pharmacogenetics across different populations, because I think this is key in driving drug development going forward. Now, we all know, and you'll know, that pharmaceutical drug development is highly expensive. And with access as a focus, which is very, very admirable, we have to continually look for ways to bring in private investment. So the World Bank, along with the IFC, last year carried out a country diagnostic study in Nigeria with a focus on the pharmaceutical sector and looking at how you can bring in a better level of private investment. So I was very interested to know, and maybe this was a question that's more suitable for the banking industry, as they spoke last. I was very interested to know, do you see any sort of potential for partnership at that level, you know, with the World Bank or any sort of world financing facility? Or do you want to limit your investors to private investors and other companies? It'd be great to understand what your breadth of interest is as far as investors are concerned, because I think that will decide what the impact is.
Okay. I'll answer the first part of that question, and maybe Charles will take the other half. Yes, it is true that drug development and discovery and development does take a lot of time, a long time to come to fruition. And that's the essence of the presentation I made. That really, we don't have to reinvent the wheel. There's a lot of drugs out there that have already been developed. The problem with them is that they're not developed purposefully for the demographics that we're talking about. So the time frame and the expense to doing such bridging studies or purposeful research is shorter and is less expensive, because you're using existing data that exists. You're not going to try to figure out what a new molecule is. If somebody's already done that work, that takes a long time. If you look at a 15-year lifespan from discovery to market, right, there's about 3 to 5 years of the latter stages that you use to prove that the drug works in your demographic. That's called the phase 2 and phase 3 studies, and probably what we call the phase 4 studies. The early part of the discovery is very expensive. And I think the model of ORx Sygen is not to engage in the reinvention of an existing wheel, but to take the molecules that already exist that we actually know have strong therapeutic efficacy, maybe for a certain population, but not necessarily for ours, and do our own repurposing studies on them, and even go back and awaken other molecules that already exist that we can, repurpose for treatments. And there are lots of drugs. Honestly, I can't say that, give you a time frame that's going to it'll be less expensive for sure, and the time frame will be a lot shorter. Now, that would mean that you can develop drugs quicker for your population. It could be as little as 2 years to as long as 5 years. So it's not the same 15 years, drug development cycle that big pharma engage in. Now, with regards to partnering with other world parties, I think depending on the therapeutic class, you might find that it's prudent to partner with people like WHO or people who have especially for drugs that are somewhat classified as pandemics, drugs that maybe afflicts the lower sector of the population. There are lots of that. I mean, it happened with AZT for HIV at some point when we had that issue, and anti-malarials, I can see it going in that direction as well. But of course, there are so many different drugs, therapeutic class of drugs, which will not fit that type of partnership, but there are obviously others that will definitely work nicely. And I think maybe Charles will want to chime in and, say what.
I think the simple answer is yes. So, I mean, if you look at it, we would definitely need some global investment. So having like an IFC support you only just makes more sense, right? Because we're going to end up going far. So yes, simply yes.
Thank you very much. Does that answer your question? Yes, it does. Number 3, quickly, we're moving on. Number 3. Okay, thank you.
Okay, so my name is Moses. My name is Moses Abba, and I want to ask a question, but the question it looks like it's personal. I just want to ask KBSC because I have a friend in Canada, and like from what I heard, it's kind of a little bit difficult to come to a place of influence and impact, especially for Nigerians and for Africans in Canada, even though there are a lot of migrations to Canada. So I just want to ask, like, what are some key things that someone who is going there needs to take note of or needs to do to have that level of impact?
Is this health related? Kabiesi, if you'd like to answer that.
Well, I'll answer the question.
Take time.
Well, it's a big million dollar question you're asking me. But I can tell you this. I mean, in the pharma sector, in the healthcare sector, Nigerians do very well. I can hazard a guess that most of my students that I've trained since 1992 to present day, maybe about 10% of them were actually Nigerians. And all of them have stayed back. In fact, I used to encourage them to come back to Nigeria. They want to come back, but the problem is they get bigger offers in those companies. And the also problem is that Nigerians are not competing to bringing them back. We don't have industries they can come back to. So they stay back. I have a lot of them. As a matter of fact, at this JV, I had so much emails coming from some of my students who are Nigerians who are saying, Prof, you're going back, you're doing this in Nigeria, please give us a job, we're coming back. It happens. So for those of you who are jackpot for other reasons, I don't I can't answer those, but for those who are in the pharma sector, healthcare sector, just stay in that line. You'll do well, but then the question is, would you want to come back? That's a question you have to answer. Thank you.
Okay, thank you very much, Your Royal Majesty. Number 4. What's your number? No. I see she's raising her hand. What's your number, ma? You don't have a number. I'll come to you. I'll see if I have room for your question. Number 4, please.
Thank you very much. Good afternoon. My name is Margaret Ilumwaya. I'm from the University of Lagos. And for context, I'm Principal Investigator, MedAfrica GMP Laboratory at the University of Lagos. So my question basically is, does Sygen-ORx Pharmaceuticals have any cogent plans to collaborate with institutions, especially institutions that are currently also carrying out some cutting-edge research? Because at the end of the day, when we look at innovation, we want to look at innovation between pharma and academia that would be bringing products to the market. And for me, this question is very important because our laboratory currently collaborates with pharma companies in the US, and we're currently developing a product for the US market. So it would be very interesting for us to be able to know if such collaborations can happen, if it's something you're thinking of. I know some members of your team have already visited our laboratory and they see what we're doing. So it's something that I would like to know. Thank you very much.
Okay, thank you. That's such an interesting question.
All right. Dr. Margaret. So, take my glasses off. So now you recognize me. So that's why you're here. So I think the simple answer is yes. Right? So that was why I was also at that lunch. So it's integral that we are going to simply yes. So well, I'll hand it over to Kawi now because he knows more of how that technical collaboration will work.
Yeah. So nice to see you here. I've heard about your GMP facility at University of Lagos. It's commendable and congratulations. It's not easy to operate under good manufacturing practices, but I haven't been there, but I've heard good things about it. But in terms of collaboration, I mean, one thing to realize is that translational studies are quite important. When you have an idea as a scientist, you want to develop a treatment for something, and you maybe have a active principle in mind, and then you do need an enabling technology to ensure that you can actually produce products that will be stable, products that will have the requisite shelf life, or products that will have the proper deliveries, rudiments prior to getting into clinicals. So one of the things that ORx and Sygen has in part of its suite is the IPs that we bring to the table. Those intellectual properties allow you to do what we call IVC, in vivo in vitro correlation studies, where you don't have to do clinical studies before you know your drug's going to work. So it limits the amount of time you spend and the amount of people you actually put your drug into to proving it to work. The phenomenal opportunity is there for you to collaborate, and if you have any, if it's just a scientific paper that you have that you're trying to pursue to see if you can translate that into a medicine or a drug that can work, and certainly we would be able to partner to get that done. Okay.
Amazing. Thank you so much. Thank you. Number 5. Yes, sir.
Yeah, this way. Okay, good afternoon, everyone. Good afternoon, our two CEOs. And first of all, to say congratulations to the partnership, to the JV. It's a beautiful one. And I see it adding a lot of values to the company and to the pharmaceutical industry at large. My question would come in form of a question and a comment. The comment to address an earlier question. So the first one will be the question. I would like you to talk about your vision or your plans in terms of R&D towards reducing the 70% of our dependence on export to locally made raw materials. You would agree with me that this would do a lot of good for the country, for local producers, and as well as reduce the overdependence on FX that you source to get these raw materials. And the second, yes, and to the comment is, yes, they don't need to go as far as to the World Bank or IFC. They should just come to BOI. My name is Babatunde Ajala. I'm the State Manager, Bank of Industry, Ogun. They should just come to BOI. Thank you.
I love how you are marking territory, sir. I like it. All right. Okay.
Yeah, I'll take the part. Yes. ORx Sygen Union, at the core of it is the R&D. And the R&D will serve the purpose of the company, as also provide a hub for other people to tap into. So you agree with me that an industry cannot grow just by growing one entity alone. So what we are doing is we're enabling those technologies here in Nigeria, allowing multiple partners to work with us. So if somebody has like just a question that the doctor from University of no, I was going to say Toronto, but the Lagos said, you know, they have something totally different that they're doing. Somebody else has totally different that they're doing. They can come to us. We'll be the hub that will enable them to be able to deploy those technologies. Now, reducing costs is very critical because we are developing drugs that would use as much of a local content as possible. You know, when you look at pharmaceuticals, you have a mixture of active principles, APIs, which is just chemical constituents, sometimes extracts, and then you have the other part of it, which are excipients, non-active constituents. Those non-active constituents, they amount to a certain percentage of the cost of the drugs. If we start using locally manufactured non-active constituents, we can bring the cost of the drugs down. And second of all, with the APIs, yes, they are chemical entities. It's basically organic chemistry. I am very shocked to see that Nigeria doesn't have an API industry. It's rudimentary. It's not. It requires commitment. You know, it's not as sophisticated as producing a finished product. So part of our partnership is also addressing that. Some of the partners that we're bringing in have you know, technology lines producing APIs that we're going to be bringing into the partnership. So all in all, long-term goal would be self-sustainability and self-sufficiency, which is something that we can learn from the other countries like India and China. They are not better than us. We just haven't waken up to the fact that this is something we should be doing. Okay, thank you.
Thank you so much.
Charles.
Charles, do you have anything to say? Okay. Please, does that answer your question? Amazing. Number 6. Okay, thank you.
My name is Shade Oguntola. I'm a journalist from Ibadan. I'm the health editor, Nigerian Tribune. Sir, you have a lofty goal, and I really appreciate you for it. But my question is centered around how you're going to solve the bottlenecks around distribution. These are days that companies produce and they drop their products into open drug markets, thereby lowering the standards. And of course, when you drop it in the open drug market, people that have good money pack everything, stack it somewhere, and then make the price go up. How are you going to circumvent that for common Nigerians that need their drugs, especially because you are going to generic drugs, and those are supposed to be more pocket friendly and accessible to everybody? Thank you, sir.
Thank you.
So I can take that. So that situation, as you said, persists today. But I think the very simple answer is that as Sygen, which is part of, you know, the collaboration, right, we're leveraging each other's strengths. So from a commercialization and standpoint, we do have that. So right now we cover about 9,000 retail outlets, right? And our goal is to cover 15,000 retail outlets directly in the next 18 months. So we started doing that, and it's all computerized, it's all digital. So it's all using GPS, so we know where those outlets are, we have the data information and all that. So that, from our standpoint, right, kind of will eliminate that kind of approach. So our own approach is getting drugs closer, yeah, to the consumer. So we focus on that last mile. So if you come back to me in another year, we'll have moved from 9,000 to probably 15,000. Yeah. So at least those 15,000 are viable. In Nigeria, you have roughly about 60,000, but only about 20 or 30,000 are really viable outlets. So yeah.
Wow. Does that answer your question?
Yeah. I just want to add one more thing.
All right. Okay.
Just to add one more thing.
Kabisi.
The scenario you related to is the people bringing, dumping drugs and then holding the drugs so the price can go up. You will notice, and incidentally, those are people that import the drugs. They do that a lot. And part of the reasons they do it is because maybe they've suffered foreign exchange fluctuations. If you order a product 6 months ago and it's coming like 3 months time now, foreign exchange has changed, it's no longer profitable for you. You have to hold the drugs and cause a shortage so that you can sell it at a higher price. That's really what is going on with those people. Those are imported drugs mostly. But with this joint venture, these are locally made products. They will not have they will solve part of this issue that you're talking about, but not all of it. But, thank you.
To a large extent. Thank you so much. Number 7, to everyone who has extra questions, I'll come to you. Please let me answer and take everyone who has gotten a number first off. Number 7. Okay. Okay. Yes, please.
Okay. Thank you. My name is Roya Ibe. I work with Leadership Newspapers. So, talking about APIs, that's my focus. We know that Nigerian pharmaceutical companies do bring in raw materials, couple them, and then produce it. That's also increase the cost of the drugs. Now, you're talking about cutting down forests, cutting down forests, cutting down some costs to lower the cost of drugs for Nigerians. I want to know, you talked about looking at API. Which one are you focused on? Because for me, malaria is one of the serious killer disease, one of them we have in Nigeria. So are you looking at producing locally producing malaria drugs? And the price of malaria drug has kind of skyrocketed in recent time. So I'm curious if you are looking at producing malaria drugs for Nigerians.
Okay, definitely. I mean, the focus of the partnership is to look at drugs that are essential to the area in question, Nigeria being one. Anti-malaria is they're critical. And, I don't know what you're taking right now. The ones that are very popular in Nigeria are the combination anti-malaria, artemisinin or whatever you call it, and then you combine it with another drug. Now, incidentally, a lot of research has not been done in Nigeria to actually know what doses and what dosing regimen actually work. There's something called malaria prophylaxis. That means you don't have to wait till get malaria before you take the malaria medication. Malaria prophylaxis, there are different doses that you could take. Maybe lower doses, lower costs. You take it prior to the beginning of the rainy season and you never catch malaria. So that's another technology that we'll bring in to give you sustained release malaria pills that you can take. You don't have to suffer the symptoms before you actually start taking anti-malarials. Now, if you look in the news in Brazil, they have a different malaria strain. It's called the Vivax strain. All of them are Plasmodium, but Plasmodium vivax is the one that afflicts them mostly in Brazil because of the climate that changes. In Nigeria is falciparum, the Plasmodium F. Now, different drugs work differently depending on the strain of the Plasmodium. So our job is to target the drugs that will really address the ones that are prevalent in Nigeria and then give you prophylaxis treatment. You know, I don't know. I mean, it's science at play, preventive. If you're a candidate of malaria, you know you get malaria every year. Okay, so you know it always happens around the same time of the year. So the prophylactic treatment will tell you what the dose should be and the dosing regimen. And when you start taking it, whether you catch malaria or not, you start taking it and you never catch malaria. You catch it, but no symptoms because your body is already primed to dealing with it. That's one innovation that we're bringing into the ORx system. Thank you.
That's beautiful. Amazing. Amazing. Okay, our final question, number 8. Number 8? Yes. Number 8. Okay, we do not have any number 8 anymore.
Right
okay.
behind you.
Okay.
Good afternoon. Temitayo Oladeyinde from Business Day newspaper. My first question is similar to what she asked, but I want to know, apart from malaria, what other disease areas are you going to be focusing on? Because after the multinationals left, we had issues of, companies were forecasting that how local people will be able to take up the gaps they are going to be leaving. So in Ventolin, in Seretide, in Panadol, and so many other drugs that we don't have direct alternative at the moment. So apart from malaria, what other disease areas are you focusing on? Then secondly, funding. I don't know the structure of your financing and the sustainability of it, but we know that a lot of pharmaceutical companies in Nigeria are actually struggling under the high interest rate and are probably chasing after cheaper loans, some kind of capital papers to generate funding and support their workflow. It's difficult for them. So for Sygen-ORx, how do you plan to circumvent that? And
thank you. You broke my rule. I said one question, you asked two, but I forgive you. It's fine. All right, Charles, have you seen?
Yes. The other therapeutic class, very obvious. Any pharmacist know anti-infectives, the key ones for Nigeria, because antibiotics, antivirals, both first generation and third generation antibiotic, cyclosporins and beta lactams. These are general class of the drugs. You might not know the name of the drug specifically, but each of these drugs, the idea is to repurpose them so that we develop delivery systems that will make them work better in Nigerian population. To give you an example, if you have to take a bottle of antibiotics to get well, in a new formulation, you may only need to take half a bottle, right? You already lowered your costs by doing that. So better therapy reduces costs. That's number one. The other side is that we also will look at antivirals. As I said, a lot of people suffer from typhoid in Nigeria. It's very predictable. The diseases that people get here are very, very predictable. Unlike in the Western world where we're dealing with very sophisticated diseases, Alzheimer's, Parkinson's and all that. We do have them in Nigeria, but those are not the prevalent ones here. Anti-diabetics is another one that we're going to focus on, anti-hyperglycemic agents. But we're not looking at expensive APIs. We're looking at the existing lower cost APIs, better developed, that works better than anything that's imported. So we can also look at antipyretics, or the ones that we use for fever. You mentioned paracetamol. There's combination drugs that actually work synergistically with paracetamol, which we call acetaminophen, but it's the same thing. And it's synergistic with acetaminophen and other agents. They work in synergy to give you better efficacy. They're not very common here in Nigeria, but they're readily available elsewhere. And these are what we're focusing on: anti-infectives, antibiotics, anti-diabetics, and drugs for pain and infection. Many sophisticated drugs do exist, but I think our initial portfolio will roll out the initial essential ones, and then later on we'll start looking at other, higher end drugs. Charles? Yeah.
Yeah, so I'll take the other part, the financing part. You heard the man from BOI speak up, right? So our focus is to look for partners that truly understand what this means. As we're speaking now, there are people online that could not be here. There are foreign financial partners, similar DFI type partners that are also watching this via YouTube. So I think that's been our focus, to look for people that is their focus. Yeah, so we're not looking at getting this from your commercial bank, right? They wouldn't be able to support what we're trying to do, because what we're trying to do has a major socioeconomic impact to it. So you are best looking for people that are aligned with what you're trying to do. So with that kind of partnership from DFIs, the interests are usually way lower, more likely single digit, and they're also very long term. So those kind of things will align with our own platform. Yeah. Does that answer your question? Okay,
all right, ladies and gentlemen, please can we give them a lusty round of applause? I think they dissected and answered all of our questions. Thank you so much to our MDCEOs. You can take your seat now. Would you like to take a photo, both of them? Do you have? Okay, all right. All right, thank you. To everyone who I couldn't take your question, I really apologize. It's because we have to go for lunch, as lunch ends in another hour. And hence, we have to cut this short. But please feel free to walk up to our managing directors and chief executive officers to ask your questions. Ladies and gentlemen, once again, lunch is served and provided outside. It's a buffet option, so please help yourself to lunch this afternoon, as there's a table prepared for you in the presence of... Exactly. So ladies and gentlemen, as we approach the end of today's event, I'd like to take a moment to reflect on everything that has happened here today, the groundbreaking announcement, to the discussions, the promises, that as we've witnessed the beginning of a partnership that will set things around and reshape the landscape of healthcare here in Nigeria and by extension the world, and that's the Sygen-ORx Biosciences. Now remember, it's not just about what we've discussed here today, but about action and what we do tomorrow. On behalf of Sygen Pharmaceuticals Limited and ORx Pharmaceuticals Corporation, thank you very much for spending your Friday morning and afternoon with us. My name is Gloria Olufeko, and it has been my absolute delight serving as your compere and officiating minister today. Good night and enjoy the rest of your day. Thank you. All right, lunch is at Cocorico restaurant upstairs. So all you have to do is just walk through the stairs and go upstairs to have lunch at Cocorico restaurant. Please enjoy your lunch. Thank you, ladies and gentlemen.